Yes, it's very reliable, so you can. This has a positive impact on your day planning. We plan 5 or 6 patients, and we don't have to worry about difficult cases. Usually it's going well, and we have a strict time frame, so that helps the planning.
Yes, it's changing our clinical practice because it's a very easy procedure to perform. Even for the beginners, it's an easy procedure. For the ones who are experienced, it goes so fast that it's sometimes surprising to see the procedure. Sometimes we might even have left atrial times of like 7-8 minutes, which in previous ablations we would never imagine that we would have those times. And by having such a short procedure time, we would be able in the future to perform much more ablation during one day.
Yes, it has changed our clinical practice because it's pretty reproducible and we can organize the workflow easy. And also it seems to be more or less the same between the operators with more or less experience. Experience is still important, but less important than for RF.
It has extended our indications to more difficult patients with large comorbidities that have persistent AF since many months. We are seeing an unprecedented degree of conversion to sinus rhythm with substrate ablation with the FARAPULSE that we had not ever witnessed with other technologies.
FARAPULSE PFA procedures are really reproducible. It's especially duration is almost always the same. It's around half an hour to 45 minutes. And you don't enter in very long or complex prolonged procedures. So that means that I can do one patient more during the day, and it's a very reproducible timing. So that makes it very easy for us to plan these procedures.
I think so. So I think for the moment, because the procedure time is so very well predictable, what we are doing now that basically in one room we are doing the FARAPULSE procedures when we know first PVI procedures with PFA and with the FARAPULSE, then we know what's the expected time of the procedure, and it makes the efficiency of one of our cath labs very we can use it much more predictable way and very efficient. And if we have anything complex, redo procedures, VTs, then we can do that in the meantime in the other room or in the third room.
Since we've been using FARAPULSE, we saw that our procedure times decreased, but also the reproducibility between patients and operators were consistent. That's why now we go mainly to schedule PVI with FARAPULSE.
Yes, the fact that the procedures based on FARAPULSE are very reproducible and shorter than other technologies, it has helped us to better plan our cath lab organization and even to increase the number of ablations that we perform per day in our lab.
I think yes, because of the time of procedure is much more reliable. So what we observed is that the standard deviation is lower, not only the time. So actually it's more reproducible, more predictable, and this helps cath lab organization.
By having a procedure that is very predictable, very reproducible, the planning of the cath lab is completely different. You can be sure if you plan 4 procedures, you will have 4 procedures being done at the end of the day.